Hey there, I'm Juan Carlos Mejia here at Medellin Dental Solutions in Clínica, Ártica in Medellin, Colombia. So I wanted to speak a little bit about the process of having dental implant treatment. So basically there are two stages: the surgical placement of the dental implant. Right after this, we need to let it heal for at least about 4 months to 6 months, depending if we need to bone graft. And then the second stage, we will put the abutment and crown. This is basically in simple terms. So quite often we need to do extraction and implant placement. So we have a lot of experience doing extraction, dental implant placement, and bone graft at the same time. Okay. Many people who already been for a previous consultation in the US or Europe or even here in Medellin, they've been told they need to have the extraction, bone graft, wait for the healing, then an implant placed about 6 months later, then healing again, and a crown. So this process will take about a year. So what I like about the immediate dental implant placement and bone graft, which again we have a lot of experience doing that, is we shorten the treatment period for at least 6 months. So let's say this case. This is a case we're gonna do this afternoon. So we have this tooth is gonna come out. This is the sinus, this is an upper molar, and we did a previous bone graft here. But we need to do a sinus elevation, okay? So we're gonna do extraction, immediate dental implant placement, and we're gonna do a bone graft as well. So everything is gonna be compressed and properly done in just one stage. So we will not have to elevate the sinus, put the bone graft, wait for the healing, place the dental implant, wait for the healing, and put the crown. So in this patient, for example, in about 7 months, he will have 7-8 months, he will have the crown on, okay, abutment and crown. So things can vary among patients. Not every patient will need a bone graft. Some patients do, and there are different types of bone grafts, from sinus elevation, from bone graft in the socket, which is another type of procedure. So these vary among patients. But let me show you a little bit, a couple of cases where we're doing crowns. We're at the second stage, okay? So for example, this person, this guy, so he has a temporary tooth over here, which needs to come out. He's over 35 years old, and this is the dental crown ready for try-in, okay? So let me just show you a little bit how this looks like. So we're at the second stage here. Implant is already healed. This is the brand called Straumann, which is one of the very best dental implant brands in the world. And we're gonna try it in. I want you to see a couple of things which are very important. So this is the axis. This is the axis where I can tighten the screw. This will later be filled with composite filling. But the good thing is we can guarantee there are no pieces of cement around the abutment and about the dental implant, and we can keep under control the polishing of the crown, of the abutment, that is very nicely finished. And as you see, it's just in the middle. We pay a lot of attention on placing the dental implant at the right position. Let me show you a particular case that a dental implant we didn't place, we didn't put in, but is very challenging for the patient. So for example, again, we didn't do this case. As you see, this dental implant was placed quite far in the back. Do you see this belly over here? We have a cantilever, and we have, is not deep enough, the placement of this dental implant. So what happened to this patient? This crown gets loose because it was not properly planned and placed, okay? So it is crucial, the right placement and the right planning of every case and dental implant. Let me show you some other case. For example, this one over here. So let me show you x-rays. So we already placed this too. these two here and here are already healed and ready for the crown placement. So we're doing them here. So these upper ones here, due to the vertical loss, we're gonna use a little bit of pink ceramic, and we're gonna see here. Just notice the location of the holes. Let me show you how this looks like. So here, I'm just showing that we're gonna use a little bit of a pink ceramic here due to the vertical loss of the bone. But let me just show you the position of the dental implants. So again, this is the brand of the dental implants are called Straumann, which is one of the very best dental implants. So what I tell my patients when I'm gonna place the dental implants is we hope to restore and put the crowns ourselves. That's my professional suggestions, because it's the same team, the same professional doing first stage, which is surgical placement, and then the crown placement. Why? Because they know what they want, they're planning, they can be accountable of treatment they are doing. So, because quite often I get the request of like they had some dental implants placed, let's say in Asia or Australia, so they have dental implants brands which are not available here. So it's just like pretty much like, let's say you have Mercedes, and you take the Mercedes to a Toyota store. Okay, they're gonna tell you, well, you need to bring it to a Mercedes store. So let me show you here. This is two dental implants. We're gonna use a 3-unit bridge here. You can see the 3-unit bridge here. So it's ready for try-in. You see a very nice placement of the dental implants. And by doing this, just 2 dental implants, 3-unit bridge, we're not putting 3 dental implants and 3 individual crowns. We're trying to get the most of the money the patient is investing. Okay, yes, we could place 3 dental implants, but this will be a lot more expensive. So we try to make things simple, things that work, and things that we believe in doing good dentistry from the very beginning. We don't believe on the patient having to do retreatments later on. That's our philosophy, doing things right from scratch. So, hope to see you guys here.